All right, so having laid out for the consumer how the marketplace is laid out and basic plan function, you would want to go ahead and see what their specific needs are to determine the type of plans you should be looking at. So a couple of good ways to narrow down the plan selection process is to figure out, are there specific doctors? Is there a specific known need that we need to accommodate? Is there a more sensible metal level for this consumer? Is there a specific insurance company that makes the most sense? And then finally, within that metal level and that insurance company, there could be more than one plan. How do we select between those different options? So here are some good ways to broach the question. I recommend starting with, did you have a marketplace plan last year? How did it work for you? I would discourage the consumer from just complaining about insurance, which unfortunately does sometimes happen. Insurance is complicated and there are often user errors. But more than that, what was it that was a problem for them? Maybe the consumer picked a very high deductible plan and this made it feel like they weren't covered because the only thing they got was a scan, but because they had to meet a high deductible first, it felt like they paid for everything and the insurance didn't pay for anything. So figuring exactly what the issue is can be helpful, but I don't recommend encouraging the consumer to just give you a breakdown of all their objections to the American healthcare system because unfortunately we can't do much about that. Figuring out, is there a specific medical need we need the consumer to think about in terms of 2018 can be helpful. Being aware that the consumer is not obligated or required to offer you information on their personal health information. But of course it does help us out if they're willing to do that. They also may have completed a document while they were waiting where they listed out their doctors and medications, and you can definitely inquire as to that because that might help us out. So sometimes a known medical need or establishment can help you narrow down plans, but the reality is not always. So for example, if the consumer says, I just need to make sure Seton Hospital is a network, well, all four companies are in network with Seton, so we need to consider some other questions. So sometimes a good idea is to kind of outline the different ways that we can narrow that down. So is the most important thing for them a low monthly premium? Are they interested in paying as little as possible to ensure coverage? Are they interested in a plan that doesn't refer referrals to go from PCP to specialty? Are they interested in a plan where they can get primary care outside of the Central Texas area? Or is a low deductible the most important thing? So determining what factors are of interest to the consumer. So this is a resource that is on the resource page, and it will let you know for some of our larger providers in town, such as hospitals, such as clinics like Community Care or Austin Regional Clinic, what plans are in network with those specific organizations. So you don't have to look up a doctor with ARC every time a consumer mentions that they want to go to ARC. You can just use this tool. This tool will give you information as well on what plans require a PCP versus what plans require a referral, etc., etc. So I always feel like you can use this as a guide, as an overview of the consumer's options connected to the different local providers. So having isolated whether they're specific providers, it's a good idea to consider what metal level makes the most sense. And a good question there is if the consumer wants to feel like they have insurance. If they pick a bronze, they will likely not, quote unquote, feel like they have insurance because a bronze plan is going to act very much like catastrophic coverage. It will have a very high deductible before anything's covered. The Sendero Bronze plan does offer the consumer primary care provider visits before the deductible, but with the Oscar, Blue Cross Blue Shield, and Ambetter Bronze option, that is not the case. So the consumer will pretty much have to eat the cost of any visits before, unless they've met that deductible, which is very high. So bronze will really only cover them mostly in an emergency. So if they want a plan that feels like insurance, bronze may not be the way to go. So silver, of course, will function differently depending on the level of cost sharing the consumer is qualifying for. But of course, silver plans, for the most part, with some exceptions, will have a copay for PCP and specialist visits and certain medications. So that might be a good option for a consumer whose total needs are completely covered by those three categories. Now, for our population, gold doesn't tend to make sense very frequently because of the income of most of the consumers we see. But if a consumer was only eligible for 04 cost sharing, that 73% or above, that might be a good sensible option for them. Gold plans this year, more than other years, could in theory be more affordable depending on the consumer's income. I think the most important thing too is metal level does not determine something being covered. It determines how it's covered. And that's important to emphasize. So to give a sense, you have an option of this bronze Sendero plan, which would cost about $2 a month, but you can see it would have a very high deductible and out-of-pocket max, versus a consumer eligible for the 06 cost sharing would pay about $11 a month for a silver version of that plan with a deductible of 0 and an out-of-pocket max of $850. So we could still see a consumer who opts to go the bronze route because they don't expect to use the plan at all and they're just looking to be covered to avoid the fine or in an emergency. So they could still definitely do that, but obviously there's a tremendous amount of value in that silver plan if it turned out they had needs because of that 0 deductible and $850 out-of-pocket max. So a consumer still can definitely go the bronze route here. They are missing out on that second subsidy, but that is their call. Hopefully, though, they would understand that going the bronze route would mean if there was an emergency, they would be paying a lot more than if they went with the silver option. I also wanted to illustrate why someone getting that 06 cost sharing, it would be kind of foolish to pick a gold plan. And here's an illustration of why. So the gold plan already would have a 0 deductible. And again, I apologize, these are 2017 plan options, but they illustrate the point the same. So the gold plan does have that 0 deductible. And if this consumer was earning $50,000 a year, they might want to go that route. That might be a more affordable option for them. But because this consumer's income is between 100 to 150% of the federal poverty level, they get that same 0 deductible in the silver plan. And the true distinction here is the out-of-pocket in a silver is far lower than the out-of-pocket in a gold because of the cost sharing. So if they went gold for this specific individual, they would actually pay a lot more to pay a lot more in the event of an emergency. So it really wouldn't make sense to go gold if the consumer was eligible for that level of cost sharing reductions. This is an illustration of what plans would look like for a consumer not eligible for cost sharing. So you can see a bronze, a silver, and then a gold option. And the out-of-pocket for each plan is quite similar. The real difference is going to be what you pay per month and then what that deductible is. Of course, with the bronze plan, the only covered visits before that deductible are the primary, whereas if you go gold and silver, you get to visit the primary and the specialist before having to deal with the deductible. Now, of course, the deductible being 0 for the gold means that you would have coverage a lot quicker than if you went bronze or silver. But of course, that does mean you wind up paying more per month. Now you can see at the very bottom of the screen the total estimated yearly cost. So what they're doing there is they're multiplying that monthly premium by 12 and then adding the out-of-pocket max. So sort of ironically, all other things being equal, the gold plan would actually cost you the most in the event that you had a health event that wound up making you hit the out-of-pocket max. The gold actually is the most expensive. But if the consumer just wound up having like $3,000 worth of blood work or $3,000 worth of scans, the gold might save them money. So this is all a matter of cost flow. It doesn't actually have any implication on what is covered. What matters is when it's covered. And it can be very, very difficult to predict which plan will save the most money unless you knew item by item what all your healthcare costs are going to be, which is very, very hard to know for sure. But the reality is $9,370, $10,722. When it comes to healthcare costs, those are still far, far lower than a full-blown emergency, and they're kind of comparably low as well. So consumers might be more comfortable considering the deductible. They might be more comfortable considering the out-of-pocket max, and you just need to walk them through what that function looks like. So selecting a company, the same as plans, all plans on the marketplace have to cover the same standards. If you have insurance, you're financially protected from a health emergency. So again, it's not what is covered, but where you can go for care and when what you need covered is covered. Remember though, consumers can always go somewhere. The importance is making sure they know where that place is. All right, so very important about picking a company. Certain companies, certain plans will offer you different options in terms of where you can go. The same medication may cost more or less depending on the company and depending on the plan you pick. And of course, certain plans may offer more primary coverage in more counties. For example, Sendero is a local organization and they offer primary coverage in 7 counties, whereas Blue Cross Blue Shield will offer some form of coverage in every single county in Texas. Now again, the usefulness of that depends on the consumer, and what's very important to emphasize is all plans are required to offer coverage for an emergency, even if out of network. So this is a document that's on the resource page, and it shows how many counties in Texas have in-network coverage, so meaning where a person could go for primary care. It lists out the different counties, it lists out whether there's a network outside of Central Texas, and whether outside of Texas there's a network. So the Ambetter plan, in theory, can offer in-network coverage outside of Texas, which is pretty unusual. But of course, it would still need to be in-network with Ambetter in that county. So not every single county in Florida is going to be in network with your Ambetter plan. It's going to be specific counties in Florida and specific providers within that county. So that's not to suggest like you have free reign to go anywhere in Florida or Illinois. You would need to be checking the networks in those states, but in theory you would have access to them. So that could appeal to a consumer if they live part-time in a specific county in Illinois. That could work out. But again, if we're just talking about concern about the emergency while traveling, all these plans have to offer coverage for that situation. All right, so assuming you've zeroed in on a company that makes sense for that consumer, again, taking into consideration where they want to be able to go locally in Austin and in a larger sense within Texas, what you need to know about the different plans is that every single plan must include essential benefits. It must cover life-threatening emergencies either in or out of network, but the non-emergencies must be in network. A good tip for consumers would be to call their plan's nurses line if they were uncertain as what to do during a medical event. Plans that are what's called HMOs must have referrals to go from primary care to specialty care, and both of those doctors must be in network for regular non-emergency care. The EPO plans, which is Ambetter and Oscar, do not need referrals, but of course you must stay in network for non-emergency care. When it comes to selecting between different, for example, Ambetter or Oscar options at the same level, what's important is the consumer's personal preference. This is a matter of cash flow. I very frequently feel like I see certified application counselors opening 2 silver Ambetter summary of benefits to see what's the missing thing. And as I keep reiterating, there is no missing thing. They are both required to cover the essential health benefits. They both have to meet the same standards of care that plans on the marketplace have to meet. So there's no need to pull open that summary of benefits. It's a matter of cash flow, of when the plan is going to kick on and start covering services. Now, Ambetter does offer certain versions of plans with vision, but there is no difference between those plans and the Ambetter plans offered without vision, except for the vision benefit, which is outlined on the resource page. And this is the document that gives an explanation of what that vision coverage offers. It's basically a free exam and a discount on lenses and frames. Pretty standard, and not a reason to pick Ambetter over a different company. The consumer can buy vision insurance outside the marketplace, separate from their health insurance. So outlined here are 3 different Ambetter Silver plans. What you'll notice differs between them is the deductible, out-of-pocket max, monthly premium, and the copays. Don't open 3 different summary of benefits to see what's different, because this is what's different, the cash flow. So this is a matter of personal choice from the consumer. They are going to cover the same things, but if the consumer is more comfortable paying more per month, $15 more about per month for a lower deductible, then they would want to pick that Ambetter Balanced Care 1. However, if the consumer, all things being equal, would prefer to pay less, have an out-of-pocket max of $2,000, that's their worst case scenario, and 0 copays to see the specialist, the primary care physician, 5 for the specialist, that could make just as much sense. There is no difference in the coverage between these 3 plans. It's just about when that coverage starts.